Hello, my name is Carter Monk, and I am presenting on the positive effects of anabolic steroid use in athletes and recreational users. What are steroids or anabolic steroids? They are also known as anabolic androgenic steroids or AAS. They are a synthetic drug that copies the effects of the male hormone, which is testosterone. It promotes muscle or the development of other male characteristics. It's naturally produced in the body, but anabolic steroids just enhance what's already produced. Um, it is mostly used for people who have low testosterone or other athletes or recreational users that usually just abuse them. How do you take anabolic steroids? There's really mainly four different ways to take them. A cream form, which it just easily rubs on the skin, usually where the injury's at, or um, on a sensitive part of the body, like the face or the hands. Injections, which most people just stick the needle down there, but you can also put it in the joint where the pain is, or there's spray, which is in an inhaler form and is taken through the mouth, or just regular oral pills. The effect of anabolic steroids. The primary purpose of anabolic steroids is to increase muscle mass and bone density, which is beneficial for multiple groups of people. Then there are androgenic effects, which influence the male characteristics such as deeper voice, more hair, and other traits. It is it can be positive if it is medically used. Um, Usually HRT, hormone replacement therapy, which is men with low testosterone. In other cases, delayed puberty in adolescent boys, muscle wasting, patients with HIV or AIDS or cancer, people who are anemic, and osteoporosis, which is where your bone density kind of goes away, and steroids counteracts that. It makes you stronger. And a lot of these are under intense medical care, so it's done right. Like these people are always getting regular blood tests, probably once or twice a month, um, and always talking to doctors. There's a study that the Harvard Health publication did with testosterone deficiencies. The group was given anabolic steroids. The results were that um, people with fractures, they had increased muscle mass, improved exercise capacity and energy, and a reduced risk of future heart disease. But as a result of this, only 30% of the patients experience side effects that include fluid retention, joint and muscle pain, carpal tunnel, and high blood sugar levels. Overall, if I was an older person and my bones were breaking down, this would be a decent way for me to become stronger and have more energy. Overall, decent idea. A big controversy is the athletic use. There's a documentary on Netflix called The Untold Hall of Shame, which is about Balco Labs, which was ran by Victor Canty. He was the main guy that gave all the athletes in the steroid era in the 80s to 2000s, like Barry Bonds, Mark McGuire, Sammy Sosa, or Tim Montgomery, which was the fastest man in the world at the time, and also the fastest woman in the world. Um, he basically had it down to a science, a very strict schedule of different injections, creams, workouts, rest, and other supplements that he made, um, and when to go on and off the cycle in order to actually stay healthy, to where they wouldn't have these bad effects. So they'd be going on um, different cycles every 2 months, 2 or 3 months. When they are abused, anabolic steroids are widely abused across the world, mainly bodybuilders for muscle mass or just gym guys. Um, with this comes a ton of health risks. There's cardiovascular issues, which are high blood pressure, high cholesterol, and increased risk in heart disease, liver damage, and hormone imbalances. You got like roid rage, um, which doesn't sound fun. A lot of people that I've actually talked to a couple people that have taken steroids, and A lot of the times they'll take it for a week or two, and then they feel like they're going to have a heart attack, and they go to the ER, and then they never take it again. The important takeaways from this are that anabolic steroids, they can be used correctly. Um, for the most part, it's really only for certain diagnosis, like low testosterone or cancer patients or anything like that. But when they're abused, the side effects are very serious or even deadly. And the athletes take them because they are under serious medical supervision. They know when to take it and when not to take it to be able to stay healthy for them, for their bodies not to break down after taking it. And that's it.